Um, since 1981, premature birth rate has jumped up 31%. The biggest jump has been between 1995 and 2005. So today, I would like to talk to you about the increased rate and some of the complications that could go along with having a preemie. According to the March of Dimes Perry stats, over 1,300 babies will be born premature today alone. In the state of Idaho, 11% of all live births will end in prematurity. So statistically, if you look at that, that means that 1 in 9 pregnant women will deliver preterm. On a national level, that actually jumps to 1 in 8. Over 500,000 babies will be born in the U.S. this year alone. There are a lot of many factors that could play into a woman delivering preterm. Some healthcare professionals theorize that we've made so many advances in the medical treatment for infertility that women that are having babies now may not have been able to 30 years ago. Other factors is a woman's ethnic background. Different races have higher rates of preterm births. If the mother smokes or uses drugs, that could put her at risk for delivering premature. If she has an underlying health issue such as diabetes or high blood pressure, or if she's of advanced maternal age, which means any woman over age 35 is at a higher risk of having a preterm birth or a baby born with a disability. If you carry multiples, that also increases your rate, so if you're having twins or triplets. And a woman that has had a previous preterm birth is 20 to 40% more likely to have another one. So now that I've given you a little bit of information about the increased rate of preterm births and what could actually cause them, I would like to talk to you about some of the complications that can go along with having a preemie. This is my son, Jeffrey. Jeffrey is a very normal and active 5-year-old. It wasn't always so with him. Jeffrey was born 10 weeks premature, and he was very tiny and fragile. Since he was so early, he could not breathe on his own. His lungs were not fully developed, so he was placed on a ventilator, and he stayed on that ventilator for approximately 2 weeks. During that time, I wasn't able to hold him, and I wasn't really able to touch him because touch was painful, and it would just startle him. Jeffrey also, at the time of his birth, had an intraventricular hemorrhage, also known as IVHs, and people may have heard it as a brain bleed. According to Sonia Lindquist, preemies that are born before 32 weeks of gestation and weighing less than 3.5 pounds are more likely to develop these. And they usually happen within the first 3 days of birth. Jeffrey had a grade 2, which is not the worst case scenario. They categorized the brain bleeds between 1 and 4, 4 being the most severe, 1 being the least. Some of the complications that can go on with having the IVH is he could have developed vision problems, a mental disorder, behavioral problems. Worst case scenario, if his bleed was incredibly bad, he would have died. Jeffrey developed left-sided weakness from his bleed, which is much like somebody that has suffered a stroke, a mild stroke might have. He also had apnea and bradycardia. It's known as the A's and B's. And apnea is basically he would forget to breathe, and then his heart rate would start to lower below a normal heart range. Jeff was incredibly notorious for turning blue on us in a drop of a hat. So to treat his left-sided weakness, he actually had to start physical therapy at 5 months of age. And one of the things that he couldn't do is if you take a normal baby and you lay him on your palm, your belly on your palm, they usually Superman out. Jeffrey would fold in half and start screaming hysterically. So with the physical therapy, we were able to strengthen his muscles. He didn't walk until he was almost 2 years of age, and that was because of the left-sided weakness. He would drag his left leg. To help strengthen his leg, they modified like a push toy. So I would take him to our basketball court in our subdivision, and I would make him push that toy back and forth up to a half an hour a day, which is a lot for like a 1-year-old and a 2-year-old. To help with his apnea and bradycardia, they placed him on a twice daily dose of prescription caffeine, and he had to wear an apnea monitor He wore it practically 24 hours a day up until he was 9 months old. And he's being very shy. Not all preemies are as lucky as my son was. I've experienced worse with one of my children. So we're very fortunate, and I think in part that was to the diligence and hard work that he had from his pediatrician, his physical therapist, and the neonatologist that kept him in the hospital for 2 months. So in conclusion, I hope that I was able to inform you on the increased birth rate in the United States, some of the factors that could cause it, and a little bit of the complications that could go along with having a preemie. On a side note, ladies, guys, if you're planning on having children in the future, I highly recommend that you start taking folic acid and taking care of yourself, because it pays in the future. You want your children to be as perfect as they can possibly be. Thank you.